This killer pandemic is virtually out of control.
Another pandemic. Crowded hospitals, shattered families. Question is, what about the future?
How many of your family members did you lose during the pandemic?
How do you feel? Are you alright?
Are we prepared for the next pandemic? Are we prepared to protect our loved ones?
We need a national lead. We need experts' collaboration.
To focus not only in communicable diseases, but also in emergent and chronic health challenges.
The world has faced a lot of health challenges. Pandemics have taken lives that could have been saved with expertise and organization. For this reason, we advocate for the preparedness for the pandemics with the creation of Centers of Disease Control and Prevention in Australia. In 1347, the Black Plague wiped out one-third of the European population in a matter of just 4 years. Dr. Edward Jenner inoculated cowpox with immunization success in a kid, a free smallpox vaccination clinic in France. In 1946, the CDC was created in Atlanta as a new component of the US Public Health Service to prevent malaria from spreading. In 1948, the World Health Organization was created for the health of the United Nations. In 1967, the WHO launched a global immunization campaign, achieving within a decade from 2 million to 0 deaths and later eradication in 1980. And in 2019, the COVID hit us, killing thousands, millions. Every family at least had one member who was infected with the virus. There was an estimation of 6.96 million reported death in the 3 years. We weren't ready for this. Our hospitals are out of capacity. We did not have healthcare workers. There was less oxygen supply. There was no vaccine. It was a world tragedy. Vaccines came later, but with challenges, had side effects. We didn't know if it was adequate for the children or if it was adequate for the aged care. The cold chain management was complex. There was lack of communication between federal and state governments. Decisions were made at that very moment, and one wrong decision always costed thousands of lives. We need an organization that will act as a frontline defense against future pandemics, which will prepare us for the pandemics, which will lead to a national response to future health emergencies, and work to prevent and control non-communicable, chronic, and communicable infectious diseases. Join us in our campaign for a CDC in Australia. Prepare today, protect tomorrow.